In the past 24 hours, 2,736 cases of COVID-19 were reported from 47 countries and territories. There is now a total of 98,023 reported cases of COVID-19 globally and 3,380 deaths. We are now on the verge of reaching 100,000 confirmed cases. As cases increase, we are continuing to recommend that all countries make containment their highest priority. We continue to call on countries to find, test, isolate, and care for every case and to trace every contact.
The system is switching on. We're seeing a much more all-of-government approach, as the DG called for yesterday. There's a national action plan now. There's 100,000 workers committed to this plan. And we are going to see any country in the face of an epidemic, when it looks for cases, will find them. And if we call that a bad thing, it is. It's a sad thing for the people who have the disease. But it's much better that we understand the extent of the problem. So we commend the move towards more aggressive, targeted surveillance, and we hope that that will lead to the kind of control measures that can help push this virus back.
1,200 for past 24 hours. How do WHO categorize?
There is a long history, unfortunately, of countries sometimes with tit-for-tat travel restrictions, and that has happened in the past. Since the advent of the IHR, in fact, we've seen a huge improvement in that and in transparency between countries, because we challenge countries who put in place travel restrictions, and we challenge them to provide the public health evidence. I think Japan and Korea are both doing a fine job in the face of this epidemic. They've both scaled up their public health operations. They're saving lives, and I think we should focus on that and not necessarily on political spats over travel restrictions. It's very, very important that people understand that these types of restrictions are not helping.
TV. If Chris is fine, we can go to one more question.
We have to assume that the virus will continue to have the capacity to spread, and it's a false hope to say, yes, it will just disappear in the summertime like influenza virus. We hope it does. That would be a godsend, but we can't make that assumption, and there is no evidence right now to suggest that that will happen. So we need to fight the virus now, not live in hope that the virus may disappear on its own.